Okay. Everybody should now have permission to record. If you run into any problems or if it did not save, go ahead and message the Joint Information Center using the chat feature. Today, we're joined by Snohomish County Executive Dave Summers, Snohomish Health District Health Officer Dr. Chris Spitters, Simone Tarver, NAACP Snohomish County Executive Committee member, and Karina Gasperin, Board President for the Snohomish County Latino Coalition. Each of our speakers will give an update, and after each of them have shared their remarks, we'll take questions using the chat feature. Please be sure to submit your questions to everyone so that all of our speakers can see. Thank you for joining us. And with that, I'll hand it over to Executive Summers.
Well, thank you, and good morning, everybody. Thanks for joining us today. Good to see you all. So we had some good news on Sunday. I was doing my Sunday morning read over through media clippings, and I came across a really interesting article from MSN, and the reporter compared the three counties in the Seattle, Tacoma, Bellevue, Everett metropolitan area. So that'd be Snohomish, Pierce, and King counties, and found that Snohomish County had the lowest infection rate of the three per 100,000 population. So our rate's about 4,600 infections per 100,000 residents, and that's less than half of the national average of close to 10,000 per 100,000. So it just really illustrated that all the hard work and sacrifices that everybody has been making have really been worth it. We've kept our infection rates low, even though we've been at it longer than anyone else in the United States. So I very much deeply appreciate everything our residents have done to follow the common sense guidelines that we've been talking about for over a year now, and keep themselves and their families and communities safe. So I want to thank also all those who helped make all this possible. The amount of work that's gone into standing up quarantine sites, testing sites, immunization vaccine sites, providing support to businesses, rental assistance. The programs that have been stood up have been just monumental, and really want to thank all the nurses, doctors, first responders, public health professionals, our health district, hospital staff, everybody that has worked in the Emergency Coordination Center. Just a deep, deep thanks. Their teamwork's been extraordinary, and you don't see all that goes into all these efforts, but it's a tremendous amount of work and a lot of people involved. So just thank you, thank you. We have people that are healthy and alive today because of the hard work of all those folks, so thank you. We know there's one way to keep everyone healthy and move us beyond this. It's get vaccinated. So the vaccine task force has done really incredible work, and we have significant capacity to move even more people through than we are. So since yesterday, the FDA provided initial approval for the emergency use of the Pfizer vaccine for those 12 years of age and older. So I'd urge everybody to try to get their shots early this week to avoid another crunch later this week when we expect the final approvals to be announced. That'll be a significant block of our residents that are able to get the vaccine. So our case counts are maintaining their flat trajectory, which is also good news. We just need to keep up the progress, and everybody knows what to do at this point. Mask up and get your vaccine. So with that, I'll hand it over to Dr. Spitters from the Snohomish Health District.
Well, thank you, Executive Summers, and good morning, everyone. So I just wanted to start this morning with a quick update on our current trends. As Executive Summers mentioned, our case rate is stable at 227 cases per 100,000 residents for the 2 weeks ending last Saturday, May 8th. And that's about 1,900 cases over that 2-week period, very similar to the 2-week period prior to that. Hospitalizations continue to increase slightly through April 29, the 7-day period from April 23 through 29. The hospital rate for Snohomish County COVID cases was 7.2 per 100,000. If you look on the DOH website, it does show a decline, but that gray line indicates that the data is preliminary. Usually the hospital data takes a week or two to catch up. Right now in Snohomish County hospitals, we have 43 COVID cases, 4 who are on ventilators. Test positivity rate countywide for the week April 16 through April 22 was 7%. Health district testing for the subsequent week ending May 1 was 8% positive. Moving on to vaccines, numbers for coverage through May 9th. 380,000 Snohomish County residents have initiated vaccination. That's 45% of the total population and almost 60% of the eligible population to date. Of those 380,000, 280,000, or almost 3 out of 4, have completed the vaccine series. So that means 1 out of 3 Snohomish County residents now is completely vaccinated against COVID. And that number is a little higher if we narrow it down to the eligible folks. That's 43% of eligible people. When I say eligible in those last 2 data lines, that means people who are ages 16 and up in the county. That's about 640,000 of the 830,000 Snohomish County residents. As Executive Summers mentioned earlier, the FDA expanded its emergency use authorization for the Pfizer COVID-19 vaccine to include adolescents down to age 12. Previously, it was only indicated for adolescents and adults with the minimum age being 16. So that adds 4 years of people, or about 40,000 additional eligible individuals in Snohomish County once a series of events occurs that follow upon the FDA's action yesterday. Here are those actions in order. First, CDC's Advisory Committee on Immunization Practices is scheduled to meet tomorrow to advise CDC on whether to recommend use of the vaccine in this age group. We're expecting a positive signal there from ACIP to CDC. Then CDC takes that input and makes a recommendation for use. Following that, our Western States Scientific Safety Review Work Group reviews data and determines whether to recommend participating states, Washington, Oregon, California, and I believe Nevada, whether those 4 states should adopt the recommendations. To date, that sequence has always resulted in a recommendation for use. This review typically happens concurrently with the ACIP and CDC review process, with the recommendations announced shortly following that announcement from CDC. Finally, in terms of logistics, the Washington State Department of Health authorizes participating vaccine providers to begin administering this vaccine in this age group, and then they start ordering sufficient supplies for that and then get shipments. Please remember that not all providers are set up to vaccinate adolescents. And for those who are set up, it's going to take a week or 2 after the this process that I described above for ordering a vaccine and then getting it on site. So parents and guardians of adolescents who will become eligible for vaccination should contact their provider for eligibility and consent requirements prior to making an appointment or showing up for a vaccine. The preferred route for pediatric vaccination is through primary care. We should remember that many adolescents have fallen behind in their overall well child and preventive care, catching up on other vaccines, etc. So the place of choice, if your child's healthcare provider has vaccine, is to go there so that they can get all of their other preventive health maintenance needs addressed. But certainly the health district and the emergency coordination center are looking at alternatives for families and individuals for whom that's not an option. I also want to remind you again that all of this may take a little bit of time for the system to finalize the processes for vaccinating adolescents in this age range. Again, call ahead before booking an appointment with your healthcare provider. We know that getting vaccinated is a personal decision, and people may still be on the fence on whether or not to do so and whether now is the right time for them. Certainly from the public health perspective, we urge all eligible individuals in Snohomish County to pursue and complete vaccination as soon as possible as our exit from the grip that COVID has had upon our society. Nevertheless, honoring that these are individual decisions and they can be quite nuanced and complex for people. We're honored to have two community members here to share more about their story and why they chose to get vaccinated. So with that, I'll turn it over to Simone Tarver, who is with the local chapter of the NAACP. Simone?
Thank you so much. So I'm so happy to be here to share about my decision to get vaccinated. So as soon as I heard vaccines were becoming available to the public this year, I made up my mind that I would get vaccinated and that I'd encourage my friends and family to do so as well. I was actually able to get both my doses recently through the mass vaccination site at Boeing, and it was such a huge relief. The past year of masks, social distancing, using way too much hand sanitizer, and basically living on Zoom had taken its toll on me, as it did to others, I'm sure. I'm incredibly fortunate to have been able to avoid getting this virus. And I knew as soon as I could get vaccinated, I would make every effort to do so and accept whatever vaccine was available to me. From what we've seen, getting COVID-19 can be really serious, even life-threatening. And so I weighed the benefits of the vaccine against these potential risks, as I would with any major decision, and the benefits far outweighed the risks. I've always been a big believer in data and science, and my trusted sources like the CDC, our health district, and folks I know in the healthcare field have all said that vaccination is the best thing we can do to stop the spread of this virus and get things back to something resembling normal. Within our local BIPOC community, it looks like the over 65 group is getting vaccinated at a high rate, which is great. But people 18 to 49 aren't getting vaccinated at the same rate, which is going to make it harder for us to get this contained. I totally understand hesitancy, especially in our BIPOC communities, because the healthcare system, in fact, most of our systems haven't always been fair to us and aren't fair to us now. Widespread systemic racism is a major issue that's killing our friends and family members every single day. But I know that this pandemic is impacting us greatly as well. We're more likely to have comorbidities that could result in more serious illness. We're also more likely to have public-facing jobs and live in multi-generational homes that increase the likelihood that we'll come in contact with someone who's been infected. Many of us have lost jobs, missed milestones with our families, and even lost loved ones over the past year to COVID-19. To me, it's clear that the best thing that we can do is continue to abide by the rules in place, like wearing masks when necessary, social distancing, extra hand washing, and also getting vaccinated as soon as we can. I'm proud to be part of NAACP Snohomish County. Our org has been doing a lot of work throughout the pandemic. In partnership with Providence and other partner organizations, NAACP has been scheduling vaccinations for BIPOC community members, helping nearly 100 people in the past few months. Initially, these efforts were focused on seniors and also coincided with efforts to distribute grocery gift cards to provide a little extra support during this pandemic. Our organization is now working on addressing vaccine hesitancy within our local Black and African American community, working to encourage others to get vaccinated and to help get our friends and family members protected. To conclude, I want to share my main why when it comes to getting vaccinated and encouraging others to do so, protecting my family and my friends. I'm fortunate to have 3 grandparents who are in their 70s, my boyfriend's grandpa who's in his 90s, and a ton of aunts, uncles, cousins, and friends locally and across the country. I love them dearly, as I'm sure you all love your friends and family, and I do anything to help keep them safe and healthy. And for me, that includes getting vaccinated and encouraging others to do so as well. So now I'll turn it over to Karina. Thank you.
Thank you. My name is Karina Gasperin. I'm the president from Snohomis County Latino Coalition. And in the moment that they told me that I was able to get the vaccine, I was so happy and excited. For more than a year, I was a volunteer in the food bank of my city, and I was serving my community, and I was in need to protect my family too. So when they give us the authorization to get the vaccine, that was the first thing in my mind. I want to protect my family. I want to keep serving my community. And the only way that I can do that is getting the vaccine. So I am a big promoter from the vaccine to everyone. It is really important that we go back to what we can feel our friends, our families, our grandpas or grandmas, and be around the people that we love without feeling pain or without feeling that we're going to cause something to them. So we, as the coalition, we've been working with Providence and other organizations in the Snohomish County. And we, as last week, we vaccinated 3,094 people. These are people from the BIPOC community with a lot of problems, with a lot of deficiencies in the community, many of them immigrants, and we were very happy to be able to do this. We've been working side by side with the Snohomish Health District to be able to provide the vaccine for our people. And it is very exciting for me to let our community know that it's safe, that there is free. They don't have to pay anything. They don't have to have insurance, and also that they can be around their families once more when they get the vaccine. So it's really important that we share information that is true, that is based in some science. Social media is a great tool, but we have to be fighting with the fake information that is around the vaccine. And that is a big issue in our community. We have people that doesn't want to get the vaccine anymore because one comment in a social media, and that makes a mess for us as community leaders to try to teach them that it's safe for them to do the vaccine. Thank you.
Thank you, Karina, and thank you, Simone, for being with us today and the great work you're doing in our community. So really very much appreciate both of you. So we've got a couple of questions. With about a week left in the pause, do you think you will be headed to phase 2? And I guess I will give the first reaction that we are in contact with the governor's office every day, and I know the health district and Dr. Spitters are in contact with the State Department of Health constantly. And given that our numbers appear to be flat and not increasing, I think that's good news. And I would expect at this point, I cannot speak for the governor's office, obviously, but I would expect at this point that hopefully the pause will continue and we can continue on this flat trajectory, and hopefully start seeing the curve go down. So that would be my expectation. Dr. Spitters, do you want to react to that?
Yeah, very similar take on things, Executive Summers. I think the intent of the pause was to see if the slowing down of the momentum of this wave was going to pan out over time, and thus far it has. So I would think that's further, again, I can't speak for the governor or the state health department either, but it tends, what's happening reflects what I think they were hoping the pause would yield. You know, all the more positive feedback for everyone in the community who's doing what they can to get vaccinated, to wear masks, and to keep doing so that we can stay in phase 3 and move beyond this ultimately.
Okay, I think the next one's for you, Dr. Spitters. Is Snohomish County planning on doing anything different for 12 to 15-year-olds who do get vaccinated at one of the mass vaccination sites?
Yeah. Well, Well, this speaks to one of the elements of my remarks where the generally for children, the ideal place for vaccination and all their health care to occur is in the medical home through their primary care provider. And so that's our baseline is to, we're currently working with the vaccine providers to see, or the Vaccine for Children system providers. These are providers who are currently signed up to give all the routine immunizations of childhood to kids in the community. And they get federally subsidized vaccine, they follow certain practices, follow the ACIP guidelines, and that's the framework for our local, statewide, and national immunization of children. And during those visits, there are also important elements of assessing children's physical and mental health, speaking with their parents, providing anticipatory guidance to parents about the children's development. So as the age of the vaccine candidate decreases, the benefits of that visit can be lost through a mass site. So, we're certainly, that's why we're encouraging this to occur in the medical home. There's so much prevention care that's been deferred. On the other hand, there are some families, some children for whom that won't be an option, either due to logistics, insurance coverage, geographic location, what have you. And so together with the Emergency Coordination Center, we're looking at how that safety net for vaccination of adolescents will look. There's likely to be a safety net. How exactly it's going to look and where that will occur is to be determined, but we'll be working through that in the next week or so.
Thank you. So next question, a risk factor decision may be made by parents and guardians to help them with that as they decide whether to access Pfizer for their children. Will the data from long COVID cases be counted at some point in the recovered data for the county COVID cases? Stated otherwise, will long COVID be measured in the data of recovered county residents? And are there any statistics available from Snohomish County cases on how many children are impacted by long COVID and the multi-inflammatory illness linked to COVID? Doctor.
Okay, so let's unpack that. Certainly, I think the question points to one key motivating factor, that even though disease in children is typically benign, doesn't lead to severe illness or hospitalization, and rarely, if ever, I don't think we've had any deaths under the age of 20 in Snohomish County. Nevertheless, certainly it's been well documented in adults with moderate to severe disease that 1/3 to a half have long-term symptoms that last 3 to 6 months, shortness of breath, chest pain, difficulty concentrating, fatigue, those being the most common and disturbing ones. There is no surveillance system. Our surveillance system for COVID does not capture long COVID nationally, statewide, or locally. There are research endeavors that look at this, but that it's not part of the standard surveillance system. When a case of COVID gets counted, long COVID, there's not an element of follow-up to that. That's sort of beyond the scope of the current emergency. And so I don't have any local data for you. I can tell you that long COVID in general is less common than in adults because the frequency of long COVID is roughly proportional to the severity of illness. And because kids tend to have less severe illness, makes sense that, it's probably substantially less than 1/3 to 1/2 that we see in adults. So it's a factor that can and should drive parents' weighing of the benefits, but it's just one. We don't have any local data on it. And we also encourage, among other factors, and that is, just reducing transmission in the community and protecting that child against future COVID and the rest of the family, their school community, trying to help open up society. I think all these things are good reasons to motivate parents and adolescents to get vaccinated.
Thank you. So we've got a question for Simone and Karina. Can you share just a couple of examples of reasons people have told you for why they might be hesitant to take the vaccine? And Simone, I guess I'll start with you.
Yeah, I've definitely heard from people that are a little hesitant. And I know one of the reasons is that people feel that the vaccines have been developed so quickly. And also some people are just generally distrustful of the government and even their healthcare providers. And I've heard anecdotally that younger people don't think that they'll get as serious of a case of COVID, so they don't feel they need to get vaccinated. And so I know these are all like major barriers for us to overcome to get more people vaccinated. But that's where community organizations like NAACP and the Latino Commission or Coalition and other community leaders can be really helpful, in that we all have our different spheres of influence. And so we can use that influence to encourage people we know to get vaccinated and be able to show them that we've been vaccinated and that we're fine, and that, you know, it is a good decision to make, you know, if they're medically able to do that.
And also I can add, many people is confused sometimes when they have to get into the appointments and the question start with the insurance and they just stop completely. Say, I don't have insurance, I don't have a way to prove that I can get the vaccine, so I just get out of the system. That's one of the big things. And also time out from work. They don't know what the how the vaccine is going to react in their bodies, and they say, I don't have 2-3 days to stay home because I need to feed my families. And the equity factors, they're really important. Sometimes they don't have cars, or they don't have someone who can help them to get into the location for the vaccines. So with the coalition that we're doing in Snohomish County, we're trying to keep the equity factors really low for them and say, what do you need from us to make this possible? This is not just for you, it's for us too. This is going to be a benefit for the community. So they are afraid of somebody's going to ask for money for the vaccine. That's a big issue. Like I said before, fake information is a big deal in the community, and they don't know how the vaccine is going to react in their bodies. So I think we need to create more educational information for them to understand, and cultural information too, because we see things in a different way. We see things in a different perspective. It depends of the community. As a Latinos, we want to see someone that is familiar with the community, and they can teach us what is going to happen if I receive the vaccine. And now with kids getting the vaccine, kids are really excited to get it, but grandpa and grandma, they are afraid what is going to happen to the kids, right? So it's a different situation right now. Thank you.
Thank you. Some school districts have been hoping for vaccination sites at schools. Any updates on this, Doctor?
Well, you know, that's certainly, as I mentioned earlier, for those families, children who are eligible and for whom the existing healthcare system either can't meet their needs or they're unable to access it, some type of safety net is going to be necessary to make sure that everyone who wants vaccination can pursue it. School is one place to consider doing that, and there may be organizations that pair up with healthcare systems, pharmacies, existing vaccine providers to do that, and the health district and the emergency coordination center we're also looking at what role we might play in that. You know, with that being one of several options for providing that safety net. I do want to say, you know, while it's energizing and exciting that the adolescents are look like they're going to be eligible for vaccine in the coming days or week. Let's not get off track too much and remember that our priority, the older someone is, the more likely they are to be hospitalized, the more likely they are to transmit. So still our priorities are those unvaccinated young and middle-aged adults, as well as the remaining 30% of adults over age 65 who have not initiated vaccination. So the kids are on the plate. But the top disease control and healthcare preservation priority is still, it remains adults.
Is the county getting through all of its vaccine supply, or are we getting closer to a point where some doses are being sent elsewhere? Doctor, do you have any information on that?
Well, we're not sending doses elsewhere or sending them back to the state or to the manufacturer or anything. There is, I think we've started to, our inventory is growing a little bit as our uptake through the mass sites has decreased, and over time, both the state health department and we are looking at sort of downgrading the allocation to the mass sites and getting more out into the healthcare community.
And do we have any idea how many doses have been administered across our recent mobile clinics and homebound visits versus outside of the adult family home vaccinations early this year? A rough idea.
I imagine that number exists. I don't have it at my fingertips. We can look it up and get it to you.
Okay, given the current rate of vaccination, where do you think the county will be in a month or so in terms of the portion of people fully vaccinated? Is 60% of adults realistic?
Well, I think 60% is very realistic. Harkening back to a question last week about the proportion of people initiating vaccination who have completed it, it's kind of been about 2/3 all the way along. And now we're seeing that as the initiators are slowing down, people completing vaccination are continuing. And, we're up to around 3/4 of those who have initiated completing. So I imagine, we ought to at least get to 90% of people who initiated completing. And we've got about 60% of eligible folks, 45% of the total population, but 60% of adults already started. So, I think that that's a minimum goal. I just think that from here out, based on, the low hanging fruit that was easy to get through mass sites and such, that's been yielded. And so now we need to, it's going to be harder, that last 30 to 40%.
Yeah, just to add to that, we're still seeing quite a few people coming through the mass vaccination sites. It's just not the rush and pile up that we had earlier. So they're still effective. I was by Monroe yesterday, and there was quite a few people there in the drive-through. But as Dr. Spitters mentioned, we're focusing our efforts, as are many people in the state and across the country, towards addressing some of the impediments that Karina talked about in terms of access and childcare and being able to take time off for work or not, and all those issues that are really barriers to a lot of people getting the vaccine. So it's going to be slower effort, but there's still a lot of people that want to be vaccinated, and we're focused on that now. So that's things are still going well in my view. Would it have past mRNA clinical trials in longer term research for other ailments, including children? Is there any data related to the impact long term in adolescents or younger kids in terms of mRNA trials?
The only other mRNA vaccine that's out there is the Ebola vaccine, to the best of my knowledge. I think there have also been some, mRNA-based work for cancer therapy, but in terms of large-scale Ebola, I haven't seen any reports of problems in kids and or adults long term from that, or from what's occurred so far with the mRNA vaccines for COVID beyond what we already know. These are some of the safest vaccines that are out there. If you compare the frequency of adverse effects to other vaccines, tolerance and safety is just as good or better than the whole palette of what we already give.
And I think the last question, would it be beneficial from an equity standpoint to start offering other vaccines at the Angel of the Winds in Everett, given its central location and transportation options? Is that being considered?
Well, I think to speak to the broader point, given that there is still demand for the mass vaccination sites, as Executive Summers mentioned, it's slowed down a little bit, but it's probably going to need and want to run that type of operation all the way through to the end. There's always a segment of the population, even if it's decreasing a little bit, that's a good route for. And then the vaccine task force just has to take into account these very factors you mentioned about access, equity, our own logistics of operating at the site, and try to pick the best sites that match where people can get to, what functions well for us. And if Angel of the Winds fits into that, great. If not, we've got a lot of other great sites that should do the trick, that are close to transportation hubs and ought to do the trick.
Just say that's why the work Karina and Simone and others is so important to us, because as Karina said, we need to hear from people on what works best for them, where the best sites, where they're most comfortable, where they can get to, etc. And so that work is ongoing, and we'll be listening and trying to adapt to really provide vaccines in the most equitable way we can, and in places that are convenient to people. So that's always part of our discussion now. I think that wraps us up. I just want to thank Karina and Simone for joining us today, again, for all the great work you're doing for our community. Thank you.
This is Heather in the Joint Information Center. I want to again echo Executive Summers and thank our speakers for joining us, and thank you to all the media and for your questions. We're going to wrap up for today, but please stay tuned for future media availabilities. Have a great day.
Thank you.